Heart failure is not a single disease, but instead it is a constellation of symptoms. In this disease, the heart is unable to meet the requirements of the body by its inability to pump, or be able to do so by increasing the filling pressures so that it might pump effectively. People should differentiate heart failure from heart attack, which is due to interruption of blood supply to the heart, or heart arrest, that is where the heart stops beating. Heart failure is inefficient ability of functioning of the heart. Inability of the pumping ability of the heart or an inefficient functioning of the heart leads to fluid logging in the body. This fluid logging can be in the lungs, which can present as breathlessness. The breathlessness can be present either on walking, or if the disease is advanced, the breathlessness can be present at rest, sometimes not allowing the patient to lie flat, or sometimes they might be awakened up from the sleep because of severe breathlessness. At the same time, there could be fluid accumulation in the other organs of the body, most importantly in the legs, causing swelling of the feet, or sometimes in the face, sometimes in the abdomen, or sometimes this abdominal swelling can lead to pain in the right upper part of the abdomen. So, these heart failure symptoms which are related to the lungs are called left heart failure symptoms. Those symptoms which are related to the other organs are called right heart failure symptoms. Heart failure is a result of many disease processes in the body. The most common disease that is responsible for heart failure is coronary artery disease. Coronary artery disease means accumulation of cholesterol in the blood vessels supplying the heart, leading to interruption of blood supply, and this interruption of blood supply can either directly reduce blood supply to the heart, resulting in dysfunction, or can cause heart attack, which can also reduce the heart pumping ability. At the same time, common diseases such as diabetes, hypertension, and sometimes abnormalities of the valves of the heart and fast beating of the heart, of which most commonly atrial fibrillation, can all result in reduced efficiency of the heart. In addition, advanced age itself, beyond the age of 65-70, the efficiency of the heart reduces, leading to heart failure. The tests for the diagnosis of heart failure are imaging tests, ECG, and blood tests. The most common blood test that is done is a pro-BNP test. If it is less than 125, we can safely exclude heart failure as the cause for breathlessness. In addition, we look at presence of anemia, renal dysfunction, and also blood glucose elevation in a patient with heart failure. Electrocardiogram remains an important test. It can detect the presence of a previous heart attack, the presence of any bundle branch block, and also a presence of arrhythmias like atrial fibrillation. The most common and important test for the diagnosis of heart failure is the echocardiogram, where we estimate the left ventricular ejection fraction or the pumping ability of the heart, or in short called as EF. The other tests done to identify heart failure are cardiac MRI and nuclear test. As we know, 2 out of every 3 patients suffering from heart failure tend to have an underlying blockages in the heart vessels supplying the heart. So, these blood vessels supplying the heart are called coronary arteries, and obstructions are called coronary artery disease. So, whenever there is a coronary artery disease, we can identify that only by performing a coronary angiography. The beauty of this investigation is, apart from diagnosis, In case if there are any blocks, those blocks can be addressed at the same time by performing a balloon angioplasty and a stent procedure. The advantage of removing the blocks in the heart vessels is there is a strong chance that the heart functioning ability can recover once the blood flow is restored back to the heart.